I'm Dr. Patricia Mills.
Oh, hi, Natalie. Thanks for having me today.
I'm so excited to talk all things aging and bone health. And so, just off the top, can you share with the listeners what are some of the typical things that you hear from women as they come in that tweaks you that maybe that there might be a bone health issue?
Yeah, for sure. So it's interesting because I'm a specialist in physical medicine and rehabilitation, trained in Canada, and also certified in functional medicine, which is root cause medicine. And so, I know a lot about bone health and learned even more in terms of the hormonal effects, what supplements and exercises we can use to prevent and reverse bone disorders like osteopenia and osteoporosis. And so there's a couple of different ways that people are looking at this condition, particularly women, right? Women tend to be more affected than men. And there's about 10 million people, in North America living with osteoporosis, and it's a significant disorder of which 8 million are women. And the reason it's important is that when you lose your bone density, right? That's what osteoporosis is when you lose the density of your bones, you are at risk for fractures, and not just any kind of fracture, but what are called fragility fractures, which means you could fracture a bone by falling from standing or even falling from sitting. And as we age, our risk of falling increases due to various different reasons. So that, the statistics are kind of crazy. 1 in 2 women over the age of 50 will have a fragility fracture from osteoporosis. So 50% of women. And if you look at women at the age of 80, should they survive that long, 70% will have osteoporosis and 27% will have osteopenia, which is the stages before osteoporosis. So, it's kind of like a spectrum of bone loss. You got your healthy bone, or you're starting to lose that healthy bone, which is osteopenia, and then you reach a certain time point, a certain amount of mineral density that is lost and you're diagnosed with osteoporosis. And so, 97% of us, if we're not doing something intentional to keep our bone mass and our bone health, will, experience this a potentially life-changing condition. Because if you fall and fracture, let's say, your hip bone, the risk of dying within the year after that fracture is as high as 50 to 70%. Depends on what happens after that fracture, depends on whether you get surgery for it, if you're in hospital. Oftentimes, once we have a fracture at that age, we never recover to our previous abilities. And so we get more fragile and more vulnerable and have an increased risk of dying. And so that is, an epidemic, we could call it that, that is completely preventable and reversible. And so one thing I sometimes hear women say is that, oh, my doctor said that there's nothing I can really do once I have osteoporosis. Like, we can improve it a little bit, but I can't reverse it. I can't get my bone mass back. And I'm a published researcher. I know how to delve into the research and read it. And there's many studies showing that you can regain your bone mass after having osteopenia and osteoporosis, and you certainly can prevent yourself from getting it. Regardless of your genetics, yes, some women are at higher risk, and it seems like genetics plays about 50% of what you have in terms of your bone health with osteoporosis is related to genetics, but that gives you a good 50% of wriggle room with what you can do intentionally. So that's very empowering information.
And when we think about the notion of health promotion and health prevention and getting our bones healthy, particularly as we enter into this perimenopause stage where our bone density declines significantly at menopause, the guidelines suggest that a bone density scan, which will tell you your bone, your muscle mass, etc., should be at 65 if with indications of risk. What are your thoughts on us sort of being proactive and understanding how our bones, how healthy our bones are as we enter into sort of this perimenopause stage?
Yeah, that's a really good question. And the answer is it depends. So part of the problem with answering this is that many women think that they're doing everything they need to do to maintain their bone health, and actually they're not doing what is necessary. So a good example is calcium supplementation. So, and drinking dairy.
Right.
So some women will say, "Well, I'm eating lots of dairy and I'm taking my calcium supplements. So, and I'm walking." I hear that a lot. Like I walk a lot, I exercise, I take my calcium, and I eat dairy. I should be okay. And unfortunately, that's not the case. As a clinical doctor, I see so frequently that women, despite all of those activities and measures, still get osteoporosis. And so it can be very eye-opening and a big aha moment when you get your osteoporosis scan results and you're told you have osteoporosis, even though you've done all those things. Now, it would be, if that were to happen, it would be amazing if you could find that out sooner.
Yeah.
Because by the age of 50, 56% of women will already have a diagnosis of osteoporosis. So it's important, I think, to understand that unless you are following some very updated recommendations based on much more recent science on how to prevent osteoporosis and reverse it, it might be helpful to you to understand your risk for it and whether or not you should be modifying your lifestyle accordingly.
And I think there's a lot of misconceptions about being physically active and eating and bone health. How important is it to be um, prescriptive in your exercise, your physical activity? And by that, I mean more specifically, how important is it to have that gravity resistance for your bones? And what are some things that women can think about doing to help promote bone health?
Yeah, so there's a couple of different things there. So the fragility fractures can happen anywhere along the arm. So falling on an outstretched arm and fracturing, for example, the wrist bone, that's a common fracture of older people, especially when they're walking outside and they fall and they use their arms to catch themselves, which, when you're younger is no big deal, but when you're older, very frequently, if not always, results in a fracture of that wrist. All the way through to your spine. So the bones in the spine, the vertebral bones, they can get fractures, and the problem with that is they can be associated with significant pain, disability, loss of height. But particularly the pain and disability issues related to that, bone fracture in the spine, which there's not really a surgery for that. There are some measures that can be taken, like injecting things into that fracture, which is some doctors offer that and some don't. But you want to not get it in the first place because it can be very, very difficult experience to have. And then there's the fractures in the hip bone, so the femur, right? And that's the one that's associated with that increased risk of death, mortality. And so different exercises will target different parts of your body. And the thing is that the bone has this very important property in that it's actually considered a semiconductor. So it's a tissue that actually carries electricity through it. And it's that electrical signal that sends the message to the bone, to all of the bone, as that signal travels up the bone, make more bone. And the way that that signal is created in the bone is through pull or push forces on the bone. So, for example, if you're walking and your feet are striking the ground and you're not wearing super cushy shoes, which a lot of us are doing these days, right? So if you're getting that mechanical pressure, you're getting some of that electrical generation at the level of the feet up to, certain parts of the bone. But research has shown that in order to get that message, that electrical message in places higher up, like in your femur and in your spine and in your arms, you actually need to do what's called strength training or resistance training. So you need to lift, push, and pull heavy objects in order to generate that electrical signal throughout your entire skeleton. And that's what women are really lacking because we went through a period of time when we were told that cardio was queen.
Yeah.
So we got into, spinning, cycling, running, swimming, and that's really important for cardiovascular health, but it really doesn't convey many benefits for bone health. And then there's Pilates and yoga, which are really great for neuromotor training, flexibility, which is important for preventing those falls. But, you could have the best flexibility and neuromotor training, but if you accidentally fall, that bone will still be weak. So unfortunately, those exercises aren't enough to give you that bone strength that you want with older age, particularly as you say, when we transition into menopause and our hormones cause us to be at higher risk for that bone loss. So we need to counteract that decline in hormones at menopause with even more strength training. So many of us never even started strength training, or maybe we do a little bit. But as we age, we need to be very, as you said, prescriptive in the amount and intensity at which we lift, push, or pull weights so that we can send that signal. Now, the good news is we actually know what that is.
Right.
So there is research that shows in women who had, diagnosis of osteopenia, osteoporosis, and it takes 8 months
Mhm.
to see those kinds of results. And that's where some of the research was very misleading, because they would take women, do the exercise program, and measure, the bone mass after weeks, even 20 weeks. That's not enough time to see the change on the bone scan. So after 8 months of doing a certain exercise routine is when you can expect to see changes in bone mass. And so for people who are initiating an exercise protocol, repeating your bone scan after, 8 months to a year of initiating that protocol will tell you if that protocol was working for you or not. And if it's not, then there's something about the way that you're lifting or the intensity at which you're lifting. In other words, the weight,
Yeah.
right? That is being lifted, pushed, or pulled.
And as a researcher, I think I like that notion of having that baseline assessment so that if you're investing time, money, into improving your health, that you can actually see that, you're making an impact. And I often see, women who are afraid of getting too bulky or they're not quite sure what they're doing. And so they gravitate towards very, very lightweight. And it's just a misfortunate that they're using that time and not getting the same benefits that they could get if it was, a more targeted, heavier weight. I do like the research around the weighted vest and wondered your thoughts on that, because I think for women who can't get to a gym or intimidated, I have seen some good evidence that, wearing a weighted vest does have some benefits to the bone, and just wondered your thoughts on that.
Yeah, so any kind of added weight or resistance is better than nothing. Whether or not it'll be enough to cause a significant reduction in the osteoporosis, or in other words, an increase in the bone mass, would have to be assessed, as you say,
Right.
as the baseline, and then you might wear the weighted vest, and then after 8 months, you might want to repeat your scans, and you should be seeing a movement in the positive direction. The thing about introducing resistance training into one's life, especially if you have osteoporosis,
Mhm.
is that you have to be very specific about how you introduce those exercises. If you have osteoporosis, you probably need supervision by a trained, exercise professional who understands this. Because if not, one of two things could happen. If the person that you're training with, or the doctor who's, the health professional who's, talking to you about exercise, they might either say you shouldn't be strength training because you have osteoporosis and the risk of fracture is high, which is actually incorrect information and very damaging information for a person to hear, because that would prevent them from getting the treatment for that condition. Or on the other end of the spectrum, you might exercise in a way that's unsafe and cause a fracture or injury. So there's a middle way, between those two ends of the spectrum, where it's like you will need to strength train in order to see significant improvements in your bone health. Now, can you see significant improvements in your bone health with changes in diet, supplementation, and hormone replacement therapy without the exercise?
You're
Absolutely.
segueing for me. Thank you. It's like,
Yeah.
yeah, let's talk about, yeah. So what, in particular, maybe we could just start at the most popular thing that we often hear around, like your calcium supplements and drink your milk, and how much legitimacy is there to, calcium, and what do you need to take with it? Can you help walk us through that a little bit?
Yeah, so, I did an entire video series on YouTube on all of these topics. And when it came to supplementation, what people need to understand is that while calcium is one important mineral in bone, there's many other minerals in bones. For example, magnesium.
Right.
About 30 to 40% of our magnesium is stored in our bones. So one sign of magnesium deficiency is osteoporosis, osteopenia. research also shows that, and we know this physiologically, is that calcium needs certain, other factors in our nutrition to be, first of all, absorbed properly, and then second of all, utilized properly. In other words, put into our bones versus staying floating around in our blood and causing problems like calcification of the arteries, which causes clogging of the arteries. You can even get deposits of calcium in tissue like muscles. And so your doctor might do an ultrasound or an x-ray and say, wow, you got some calcification, in your muscles. And what that can be is that, you've gotten your calcium into the body, but you don't have the nutrients that are necessary to actually take the calcium into the bones, which is where you want it to be. So other supplements, or let's say, either it's going to come from your food,
Yeah,
or unfortunately, our food supply is very deficient in these minerals and vitamins these days, just because of the way it's being raised and the depletion of our soil, and pesticides killing the microbiome in the soil, which really locks up the nutrients in the soil and doesn't make it as available to the plants. In addition, stress, so mental, physical stress, depletes our magnesium stores, for example, right? Because the body needs magnesium to cope with stress. So if you have too much stress coming in and not enough magnesium coming in to meet that demand, you're going to become, deficient in magnesium. It may not show up in your blood work. So blood work is not a good test for magnesium deficiency. It could actually show up in different tissues, such as the bones. So magnesium supplementation has been studied in women, and supplementing with magnesium has been shown to improve bone mass by 70%, improve bone mass in 70% of the women who took the supplementation. And in 16% of the women, they actually stopped losing bone mass. So they followed these women over time, gave a very specific supplementation regime, and that, supplementation improved bone mass and stopped the loss of bone mass. That's one example. The other example is vitamin D3. So vitamin D is necessary for the absorption of calcium. Vitamin K2 is important for calcium to be sent to the bones versus sitting around in the tissues, and so on and so forth. So there were 7 essential supplements that I came across. I'm sure there are more.
yeah,
And typically a whole foods diet would cover you. However, like I mentioned, due to modern day stress and modern day farming practices, supplementation in many cases is actually not optional, it's necessary to
yeah.
prevent and reverse osteoporosis, unfortunately.
And if we go to sort of the calcium, magnesium, vitamin D3, K2, as would you say those as the core bone health to make sure you're having? Um, Magnesium is particularly tricky for women in that I mean, there's so many options of every vitamin, but if we just take the example of magnesium, the citrate, the bicarbonate, like how do women know what to take?
Yeah, so magnesium is always magnesium. It's what it's attached to that changes where it goes in the body. And so that's where you get the difference in effects with the different kinds of magnesium. So magnesium citrate generally tends to stay in the gut. So it's really good for, relieving constipation, because when the magnesium stays in the gut, it pulls water into the gut, which causes a flushing effect. Great for constipation, not great for bone health. And, very popular supplements like Calm have primarily magnesium citrate. So again, not the kind of supplement I'd recommend for bone health. Magnesium bisglycinate or glycinate, that is better absorbed into the body and tends to have better effects at the level of the tissues.
Okay.
And magnesium threonate is the one that can get past the blood-brain barrier into the brain. And so if you're getting a magnesium deficiency in the brain, which can show up in multiple different ways, some people can, benefit from that. Now, that would require some working with a health professional sometimes to figure it out. But generally speaking, when I talk about magnesium for bone health, I'm talking about magnesium bisglycinate.
Hmm. And how important is protein? We know increasing your protein intake for muscle, particularly during menopause. But does it have an impact on our bones as well?
1,000%. So fortunately, there's really good research that we can rely on. If we look at the amount of protein we need from a bone health perspective, the answer is pretty clear. You need about so osteoporosis was very prevalent in people who consumed 16 to 50 grams of protein per day. So anything less than 50 grams of protein per day puts you at significantly increased risk of osteoporosis. However, if you overconsume protein, if you overconsume protein, you actually can start to lose calcium. So there's a sweet spot for protein. There is such a thing as too much protein. And it can be also very tough on the liver because the liver is the one that does the job of taking protein and breaking it down and, so on and so forth. So there's a range within a Goldilocks zone, so to speak, for protein. And it seems like in general, if you use the rule of thumb of 1.2 grams of protein per kilogram of ideal body weight, so not the weight that you are, but the weight that you should be, quote unquote, right? For that ideal, for your height, for example, you might, have a certain idea as to what that weight might be. If you do 1.2 grams per kilogram of ideal body weight, you're in a pretty safe zone. Now, some people will say 1.6, 1.8, up to 1.8, it seems to be okay. Once you start getting into, 2.1, 2.2, 2.6 grams per kilogram, that's when you start getting into, this could be potentially harmful in the long term. And we don't actually have any studies long term on people consuming very high amounts of protein per day, more than 2 grams per kilogram of ideal body weight of protein per day. We have short-term studies on elderly people, and it shows that, elderly people do benefit from more protein than younger people do. So maybe bumping up to that 1.8 grams per kilogram, of
Yeah,
protein per day.
yeah,
And then if you look at, well, how do I split it up in my meals? And it's about 20 to 25 grams, sometimes 30 grams of protein per meal. Now, that's assuming you have 3 meals a day. And what I like to tell people where they really, I think people are really making a big mistake when it comes to protein is that they're starting to try to get protein in at their snacks, like big protein amounts with snacking, which means that now they're reaching for protein powder and protein bars. And the problem with protein powder and protein bars is that the majority of them actually have very undesirable ingredients that over the long term could harm your gut health and your hormone health with hidden sugars and hidden preservatives that have been shown to cause problems in humans. So it's much easier to have a snack of like a fruit with some nuts, for example, right?
yeah.
And maybe some beef jerky if you want to, for example, or some kind of, soy, whatnot, but still keeping it whole foods, really avoiding the ultra processed and then focusing on the whole foods options of proteins for breakfast, lunch, and dinner, whether it's animal or vegetarian protein. Actually, soy protein, I'm an omnivore. I eat from plants and animal sources. And the good news is that soy protein does have the ability to provide the kind of protein that improves bone health.
Good. Great. So we've covered exercise, we've covered nutrition. We were to switch now to hormone therapy, and some of the misconceptions or misinformation around it. So, the guidelines indicate hormone therapy as, a positive impact for bone health for women in menopause. Can you just talk a little bit around the evidence around hormone therapy for bone health?
Yeah, so the Women's Health Initiative trial, which is in the early 2000s, which is the one that's most cited, the most known, for those of your listeners who aren't aware of it, was thousands of women who were put on hormone replacement therapy. They were already postmenopausal. Most of them were, in the older postmenopausal stage, and they were put on hormone replacement therapy and compared to women not put on hormone replacement therapy, and they were followed over a period of years to see what the results were. Now, there were many things that came out of that study. One of the things that came out was that it did help to reduce and prevent osteoporotic fractures by about 30%. So, either estrogen or estrogen plus progesterone. Progesterone alone does not have that effect. So it has to have some kind of estrogen therapy in there. Now, the concern with that was at the time, there was a concern for increased risk of breast cancer, and the way that the media and even some of the investigators in the study talked about those risks scared everybody off of hormone replacement therapy or HRT. We now know from repeat analysis, like, analyzing the data and looking at the data in a way that gives us a very realistic view. It was actually a very minimal increased risk in breast cancer 1,000. And in the women who got breast cancer, their risk of dying was actually less than women who got breast cancer in the non-HRT, so it's kind of a weird sort of and it was only the progesterone group that
Right.
actually got the breast cancer, and the progesterone used in that study isn't even used anymore. So it's a completely different kind of progesterone that people are receiving now without that risk. So it may have a risk of increased breast cancer, but it's going to be less than an increased risk of 1 in 1,000. And research is showing that if you do get breast cancer, it will have been protective to have been on HRT. Your risk of dying will be less if you were previously on HRT. So, it's playing out now that this, concern with breast cancer is not, the concern that it was, played out to be at that time, like talked up to be, and that the benefits, even the menopause, the North American Menopause Society will say that the benefits of HRT outweigh the risks, particularly if you start it early, in menopause. However, even late use of HRT in menopause, there's some really great studies. I think it's called EPIC it's a French study, right? A large cohort study of women in their 70s, 80s, 90s taking HRT. And they showed that the women on HRT had actually better longevity. They lived longer and they did have better health outcomes, such as stroke, for example, when they analyzed the data. So I think we're moving towards a future where HRT is something that will be regularly offered for every woman. And the question isn't so much, should you be on it, should you be on it short term or long term? Because for bone health, it needs to be long term, right?
Absolutely.
Um, and should we only start it younger versus later? I think it'll be, if you want to start it later, you can. But, let's make sure you don't have a personal history of breast cancer, because that does change the risk analysis, right? A family history of breast cancer is okay. You can do it with a family history. Make sure you haven't had a previous heart attack or stroke, because that also changes the risk, but it can help prevent if you've never had one. So it's kind of these funny little things, like the devil's in the details. Um, but I think every woman will just undergo a very basic risk assessment, and most women will be eligible for HRT. And then the question is, do I want to use this option? And my thing is, you don't want to add HRT to a toxic lifestyle. And, because if you're taking HRT and you're not eating the right foods, and you're not exercising enough, you're not supporting your whole body health, you may over time run into problems, because HRT works really well when your foundational health is good. And HRT, just like anything, can be problematic if you're having issues, for example, with inflammation in the body due to your lifestyle. So these are things that are hard to pick up on in the research, but it might explain why when you do a study, some women do very well with it and some women don't. Some
Right.
women don't do well with HRT, and that could be the defining factor is, what else are you doing in your life? So I think the way I talk to people is make sure you got your nutrition right. And, I did a whole video on that topic, and it's actually kind of surprising what the kind of nutrition you do need to prevent osteoporosis. Make sure you're exercising enough, because you might get some gains with HRT, but you'll get way more gains if you're doing the right kind of exercises. And it's only 30 minutes twice a week. It's not a big time commitment. And if you need to supplement, I mean, HRT works better if your bones have the nutrients it needs to make more bone, right?
Right.
If you're deficient in the minerals and vitamins that your body needs to make bones, you're not going to get a really great result with HRT. It still needs the building blocks.
Right. 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 And when we go to, we talked about genetics as an impact. What are some of I mean, I think we all know them, but it doesn't hurt to hear it and get a little bit of motivation. What are some of the lifestyle risk factors that, maybe we think we got away with when we're younger, but really, for our bone health, we need to stop doing.
Yeah, I mean, not exercising with strength training is one of them, eating foods that, junk foods, fried foods, too much sugar, alcohol. So, what our body was able to tolerate when we were younger in terms of alcohol intake, even though it may have been low to moderate intake as we get older. Our hormone fluctuation changes the way that we metabolize alcohol. You can feel it even when you're not in
Right.
menopause. Like, just before you get your period, you may notice that when you drink alcohol, you experience its effects more than, any other stage of the cycle. That's because your hormones are at their lowest point, and it changes the way your body can use alcohol. And so when you hit menopause, that's every single day, right? So some people may say, well, I always used to be able to drink a glass of wine when I came home from work, or a couple of glasses of wine on Friday and Saturday. And you may notice that as you age, that's something that just won't work for you anymore. You might feel it the next day, and those sorts of things. So
That
I think
alcohol
it's really,
impact our bone health? Does alcohol consumption
yeah.
impact?
So yeah, unfortunately, yes. So again, it seems to be a quantity and a Goldilocks zone. Actually, less than 12.5 grams of alcohol per day may even be protective. So having
Good.
a
Some
little
good
bit,
news about
yeah.
fine wine.
Yeah, right. But more than 50 grams a day has been associated with a significantly increased risk of osteoporosis and fractures. And that is probably also influenced by genetics, right? Some people can handle alcohol better than others. So, it's hard to know where you are on that spectrum of what you can't or can't tolerate. So it's safe. They're saying there's no known safe dose of alcohol. I don't think that that's necessarily the case. You're probably okay having, a glass of wine once to twice a week on a you're having it with a meal with friends, you order a glass of wine or whatever it is that you like to drink. When you have it on a full stomach, it doesn't tend to disrupt gut health as much, right? And so doing those kinds of strategies, keeping it social so that you are adding to your quality of life. You have to tune into, are you using alcohol to self-medicate because come home from a stressful day, ideally finding other ways to reduce stress and manage stress through the week is better, not just for bone health, but overall everything health, right? But again, it is important that you reduce that stress. So some studies show that a tiny little bit of alcohol, again, that maybe that we can merge the two scientific data and say less than 12.5 grams per day when used for stress reduction might actually be better than nothing at all for stress reduction. So it's you have to be careful not to focus on the trees and really look at the forest, because when we talk about bone health, we can't forget about brain health, right?
Exactly.
And liver health and gut health. So
Yeah,
you have to take all of those things together.
everything into consideration. Any final words or advice to women entering perimenopause and menopause about their bone health?
Yeah, so unfortunately, the standard, recommended lifestyle by Western medical doctors, including myself, right, until I got the additional training in functional medicine, we are not actually trained or taught on how to counsel women on preventing or reversing osteoporosis, other than saying you should be, exercising and taking calcium. That's basically the two recommendations you're going to get from a Western medical doctor, unless they've done additional training in the area. They've really dove into the research. So either functional medicine or a particular interest. And there is so much more that needs to be done. It's not hard to do, but it's forming the habits around that. And, change is hard for people. Like changing lifestyle often becomes the biggest barrier to achieving better health. And unfortunately, when it comes to bone health, what you don't know can harm you. So you do have to educate yourself on things that will prevent and reverse osteoporosis. You need to know that it is preventable and reversible, and have that knowledge to motivate you to then go in and, go to my, Dr. Patricia Mills, MD, look at my bone health playlist and just, really immerse yourself in that data, pay attention to the studies that are out there, and become more aware, because health wisdom is what's going to make the difference for you. And even if you have really severe osteoporosis, you can improve it. Can you completely reverse it? Probably not if it gets really severe, right? But if you're mild to moderate, or if you're in the, prevention phase, we should not be having this epidemic, and
Yeah,
it's a sign of our modern way of living.
right.
And so we need to be intentional about adding certain our lifestyle to, not to counteract that.
Yes. Well, thank you very much. I think this is just packed with information, and we'll be sure to share the links to some of the resources that you mentioned as well, Dr. Mills. Thank you so much.
You're very welcome, Natalie. Thank you for having me. I hope you all have a wonderful rest of your day, evening, or night, depending on when you catch this.
Exactly. Thank you.